and six-time Grammy Award-winning gospel and R&B vocalist who is joining us by WebEx video conference. And Amanda Brock, Senior Vice President of Clinical Services and Mental Health Cooperative. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. COVID-19 numbers continue to climb nationwide, surpassing 3.5 million cases and more than 138,000 deaths in the United States. The state of Tennessee is reporting more than 69,000 total cases with 783 deaths. Davidson County has had 15,757 confirmed cases with 148 deaths related to COVID-19. Now, there are 5,219 active known cases in Davidson County right now, but many thousands more are asymptomatic and unknown, and all are vectors for the disease. Limiting the spread from these cases is the work at hand. The success of our city and our economy depends on it. And at an infectious disease event held at Georgetown University on Tuesday, Dr. Anthony Fauci warned that we haven't even begun to see the end of it yet. And the coronavirus outbreak now has the potential of becoming as serious as the 1918 flu pandemic, which killed more than 675,000 people in the United States before it was over. The University of Washington's IMHE model is projecting that 224,000 people will die from the virus by November 1st. This is an increase of almost 16,000 estimated fatalities from their projection just last week. The increase in projected deaths is due to the spike in cases across several states, including Tennessee. The IMHE also stated that we could save 40,000 lives with widespread mask usage. Texas reported a daily high number of new cases Tuesday at nearly 10,800. Mississippi and California have both reported its highest numbers of COVID-19 related hospitalizations since the beginning of the pandemic. And here in Nashville, our 14 daily case average continues to rise and is currently at 343, up from 242 2 weeks prior. Our transmission rate remains high at 1.21. Both metrics are in the red. Now, we currently have 18% of hospital floor beds available, which is less than our target of 20%. This is a concern. 23% of ICU beds are currently available, which is satisfactory. Now, as I mentioned on Tuesday, the numbers we are seeing make it clear we are unable to move out of our modified phase 2 or change our current restrictions on gathering size limits or bars. Metro is working hard with its partners to increase our testing rate across the county, with more than 129,000 total tests performed to date. Based on our 7-day moving average, Nashville is currently conducting 324 tests per 100,000 residents every day, which outpaces any state health department in the country and many of our peer cities' efforts. For example, in Austin, Texas, the Travis County Health Department reports they're testing 129 out of every 100,000 restaurants. In Charlotte, North Carolina, the Mecklenburg County Health Department is testing 271 out of every 100,000 residents. There is need for more coordination at all levels of government to create effective policies and marshal the resources needed to fight the COVID-19 outbreak, as other countries have done to flatten the curve of the virus successfully. Differing state responses have led to a patchwork of protocols and restrictions. Tennesseans should be aware that we are restricted in traveling to many other states, as each state struggles to protect itself, each with different responses. We need a coordinated effort on contact tracing, testing, supplies, and policymaking. Meanwhile, in Tennessee, only 3 of our 6 adjacent counties currently have mask ordinances in place. Success in a pandemic will require more than an every county for itself response to the coronavirus. Epidemiological data and case reports, both here in the United States and abroad, have shown that a coordinated effort can flatten the curve of the coronavirus. More and more states are recognizing that within their jurisdictions, they can only be as strong as their weakest link. Just yesterday, Alabama and Montana issued statewide mask orders, joining Kentucky, Virginia, North Carolina, and 22 other states with statewide mask orders in place. Alabama currently has just 87% of the total cases in Tennessee and has not seen the same peaks in daily case numbers that we have seen in our state. Alabama's leaders responded to the sharp spikes in cases and strains on their hospital capacities, strains also seen in neighboring Florida, Texas, and Mississippi. Researchers in the National Academy of Sciences found that in New York, the daily new infection rate dropped by 3% per day after a policy requiring that people wear face coverings or masks in public took effect, reducing the number of infections by over 66,000 in less than 1 month. In one simulation, university researchers from Cambridge, London, Paris, Hong Kong, and Finland predicted that 80% of the population wearing masks would do more to reduce COVID-19 spread than a strict lockdown. This means that if 8 out of 10 Nashvillians were to faithfully abide by Metro's face covering order, we could successfully avoid reverting back to earlier phases in our roadmap. Masks save lives and get people back to work. Until we have a vaccine, this is the best tool we have. Now, these findings were echoed by the director of the CDC, who noted earlier this week that the coronavirus outbreak could be controlled in just 4 to 6 weeks if people were disciplined about wearing masks. Don't share your air, Nashville. It's our responsibility to wear masks in public places to keep ourselves and each other safe. We should also remain mindful of the 3 C's, which present us with a much higher risk of virus transmission: closed spaces, crowded places, or close contact settings. We've spent over 2 weeks on education and awareness efforts about our new mask ordinance. Public signs are in place to inform visitors in our main tourist districts about the order. Starting yesterday, MNPD officers have been instructed to issue citations to anyone in Davidson County who is not complying with our countywide mask ordinance. People do not have the right to bring the disease here and spread it. Many people may not know that that is what they are doing. Masks are needed because of the frequent asymptomatic nature of the disease and the lag time in showing symptoms. You don't know if you have it, and you may have already spread it. Break that cycle. Wear a mask. Let me be clear. A violation of any public health order in the state of Tennessee is a Class C misdemeanor by default. In Williamson County, it has been upgraded to a Class A misdemeanor, punishable by a $2,500 fine or imprisonment up to a year. It is the duty of every Metro police officer to enforce this law, knowing full well that the coronavirus pandemic requires a coordinated response, and that unlike other Class C misdemeanors, the lives of both residents and tourists are at considerable risk. Also, our economy. As a reminder, you must wear a face covering, either manufactured or homemade, in any public space where social distancing cannot be observed. There are, of course, exemptions that follow public health best practices and common sense, including children 12 and under, those with medical conditions that prevent the safe wearing of face masks, anyone eating or drinking at restaurants or similar establishments, while you are exercising, and while you are traveling inside your own vehicles. Yesterday, Metro received a donation of 100,000 masks from SC South. This is in addition to the 140,000 masks Metro Public Health currently has on hand. Any Davidson County resident or small business owner who needs a mask can visit the Lentz Public Health Center Monday through Friday from 9 a.m. to 3 p.m. and receive them. You can learn more about our mask ordinance and how to comply with the order at covid19.nashville.gov. Our updated contact tracing investigations show slight progress on several important sources of COVID-19 infection, including community spread and workplaces. Two areas that saw an increase in infection rates are domestic travel and mass gatherings of 1,000 or more people, which are still allowed in other counties. I urge everyone to carefully consider vacations and trips to destinations with high infection rates and attending large gatherings outside of Davidson County. If you choose to do so, watch carefully for symptoms of COVID-19. And do not hesitate to receive a free diagnostic test at one of Metro's 3 community assessment centers. Over the past month, we've also seen clusters among construction sites throughout the county. And starting this week, I will direct Metro Public Health to closely inspect and enforce all public health orders, including our mask ordinance, at construction sites across Davidson County. If you see any public health violations at a construction site, do not hesitate to report it at hub.nashville.gov. Now, it's my pleasure today to welcome B.B. Winans, the 6-time Grammy Award-winning gospel and R&B vocalist who's recently recovered from COVID-19, as has several members of his immediate family. B.B. has joined us by video conference this morning to tell us all about his personal experience with the disease and to warn all of us about just how easily the virus can spread, even among those who least expect it. The coronavirus pandemic has taken an immeasurable mental and emotional toll on everyone. We know that times of crisis can create or compound anxiety, depression, substance abuse problems, and other mental and behavioral health issues for all Nashvillians of any age. Now, in fact, a recent Vanderbilt study suggests that 1/3 of children between the ages of 6 and 17 may be at risk of a mental health condition such as ADHD, anxiety, or depression, which the COVID-19 crisis can exacerbate. If you or a loved one is having a difficult time and need help, please remember that help is available. Visit the Metro 19 website at covid19.nashville.gov and the COVID-19 Response Fund website at nashvilleresponsefund.com. These websites have several important resources to help you learn more about what you may be feeling and ways you can get help immediately or when you're ready. And this morning, I want to welcome Amanda Brock, Senior Vice President of Clinical Services at Mental Health Cooperative, who is here to tell us about how we can look after our mental health and the resources that are available among our community partners. I'll now turn it over to Dr. Al Shahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 16,079 confirmed cases. That is 623 new cases since our last update on Tuesday. There are currently 5,182 active cases in Nashville, which is down 252 since Tuesday. 67% of all confirmed cases, or 10,746 residents, have recovered. 7 Nashvillians died from COVID-19 since Tuesday. 147 Nashvillians have now died because of this virus. The mortality rate for our city is still 1%. Our 14-day rolling average of new cases continues to increase. This morning, the average is 340. That's up 29 cases more per day since this time last week, and 95 cases more per day from 14 days ago. As the mayor noted, 23% of ICU beds in our region are available and 18% of hospital beds are available. 204 people are currently hospitalized in Nashville hospitals with COVID-19. I'm in contact with area hospitals daily to monitor hospital capacity. As I've noted before, hospitalizations lag behind testing, and with the high number of new cases, our resources could get stretched. Right now, our hospitals are keeping up, but the pressure on our hospitals is increasing, and this is top of mind for me and Mayor Cooper. Overall, nearly 132,000 Nashvillians have now been tested, and 12% have been positive. However, over the past week, 18% of those tested have been positive. This is concerning because it's showing that the virus is not slowing down in our community. Yesterday, we changed our community assessment site hours to 7 a.m. to 1 p.m. These are still open Monday through Friday, and the change in hours is to help our staff deal with the heat, as well as help our people who are visiting to assist them with the heat. If you have any concern about the virus, please call the hotline or go to one of our assessment sites. Now, I want to speak to you about the importance of wearing a mask. Earlier this week, CDC Director Robert Redfield wrote an editorial in the Journal of the American Medical Association in which he stated the following, and I'm quoting, "Broad adoption of cloth face coverings is a civic duty, a small sacrifice reliant on a highly effective and low-tech solution that can help turn the tide favorably against COVID-19. Now is the time for you to do your civic duty to fight this crisis. If you truly care about kids going back to school, wear a mask. If you truly care about our economy opening back up, wear a mask. If you truly care about the future of our city, our state, and our country, wear a mask. This is what it takes. Please wear a mask if you truly care." I now would like to introduce Mr. Benjamin Beebe Winans. Thank you.
Thank you, Dr. Jahanger, and to Mayor Cooper, Chris Song, and the rest of the panel. Thank you for having me as part of this press conference on today. My experience with COVID-19 was a surprise to me because from the beginning, I took precautions and followed the CDC guidelines. But when I returned home to Nashville from a short travel, on March 15th, I started coughing out of nowhere. And so that next morning, I continued what I always do, my 8-mile run, my regimen of training at my home. But when I returned, I felt very fatigued. And while getting dressed that same morning, I started to shake. I had the chills, but it was not until I poured myself a glass of lemonade to discard it because I had no taste. I knew something was wrong, so I picked up the phone and I called my doctor. And after explaining the symptoms, we both agreed and I knew I had contracted the virus. So from that moment, it was important to me to not only take care of myself, but also take care of my family, to take care of my neighbors, to take care of everyone I came in contact with. So I did just what we're asking. I wore a mask, I social distanced, and I continued to stay at home. I am grateful because after 4 weeks battling this disease, I was liberated. And I give all thanks to God's grace and his love towards me. In closing, I would like to say this. There's a thought that hit my mind today. And it is very simple. For years, for decades, we have been battling cancer. And I'm sure all of us have been touched one way or the other by this horrible disease. But if it was told today that if we all just wore a mask, we would dismiss and the disease of cancer would be eliminated. We would all jump and do that. So today, I'm asking all of us to join in. Let's wear a mask. Let's social distance. Let's wash our hands and stop this terrible disease, COVID-19, in its tracks. If we do so, then Nashville would be a beacon of light, not only just to our neighbors, not only just to our country, but around the world, we would signify that truly united we stand, and united we can defeat any and everything. So to my Nashvillians, I will do exactly what is asked of me because I love my country, I love Nashville, and I love you. Thank you for having me a part, and together we can achieve just that. Thank you.
Thank you, Mr. Winans. I'd now like to introduce Amanda Brock from Mental Health Cooperative.
Good morning. The impact of the COVID-19 pandemic is not only affecting the physical health of individuals in our community, but it's also severely impacting the mental health of our community. Unlike the physical impact, we do not have to test positive for COVID-19 to have an emotional or mental health crisis as a result of what we are all experiencing. It is important to note that during these very stressful times, things can manifest in certain ways that are frightening to our neighbors, our friends, and our family. We can all experience extreme fear about our health, the health of family, and the health of friends, extreme isolation, feelings of helplessness and hopelessness, extreme worry about financial struggles, loss of job, loss of contact with our normal support system, changes in sleep patterns, difficulty concentrating, and worsening of chronic health conditions that were previously controlled. We also know and have seen an increase in the use of alcohol or other substances when our community is stressed. Increase in incidents of domestic abuse, child abuse, and elder abuse is also a problem, particularly during these times. Now, while all of these things are incredibly scary and frightening, it's important that we recognize them and that we know that resources are available in our community to assist. And many, if not all of these resources, are available to people free of charge. So it's highly important that people don't be afraid to reach out and to seek services. The first one I want to tell you about is the Mental Health Cooperative Crisis Line and the 24/7 Crisis Treatment Center. The crisis line number is 615-726-0125. That is a 24/7 staffed number with mental health professionals who can assist if a child, adult, it does not matter the age, is experiencing a mental health crisis. That could be anything from having suicidal thoughts, an acute stress reaction, severe depression. We encourage people to reach out, place a call, talk to our counselors, and then they can either direct them to our crisis center, which again is 24/7 and it's located in Metro Center, or to other resources in our community. Also, for individuals who are experiencing issues related to alcohol or substance abuse, the Tennessee Red Line is a 24/7 number that can link them with available treatment in our community. Again, we encourage people to reach out. Don't be afraid to place that phone call. And then for those individuals who may be at risk of domestic abuse, the YWCA is available 24/7 to assist individuals who are experiencing that, and we encourage everyone to reach out to them if you're encountering that situation or you have loved ones that are. The number to the YWCA is 1-800-334-4628, and they also have a text line because we know that people are often more comfortable texting versus making that phone call. That text line number is 615-983-5170. If you know of anyone who you suspect may be suffering from child abuse or elder abuse, it is our obligation to reach out and to report those situations. The number you can call is the Metro Office of Family and Safety. That's 615-880-1100. And last but not least, our frontline healthcare workers are experiencing extreme stress due to the burden of taking care of people during this time, as well as being worried about their families. So we have established a toll-free number for those individuals to seek care and encourage any of the healthcare worker, if you are having difficulties, please reach out. That number is 888-642-7886. Thank you.
Thank you, Ms. Brock. We'll now open it up to questions, starting with Nancy Amons at WSMV. Nancy.
Hi, thank you once again for taking all of our questions. A question for the mayor. We understand that police did not issue any citations yesterday. We were on Lower Broad and saw them giving people warnings instead of citations. How does the mayor feel about the police department's enforcement about the mask mandate?
Thank you, Nancy. Mayor Cooper.
Well, thank you, Nancy. Appreciate the question. I think we all feel that we can enforce all 80%. Most people are complying. We need 80% of the population to be wearing a mask at least. If we can do that, we can be effective, we can get back to work, we can save lives. Most people are doing it. That small sliver of people who aren't need to be reminded and educated that this is the right thing to do as a citizen. And I am grateful to our police department for stepping up in this time of Nashville's greatest need to remind everyone to do their part. People, there are disease deniers, you know, that they don't think this is real. They've not spent any time in our ICUs or talking to our frontline health workers. They need to be shown the right path to do it. We're a friendly and gracious town, but people don't have the right to come here and spread the disease. They may not know that they have the disease. This is why having the mask is the precaution that is going to be able to get us to a better place, and we need to work together. But if enforcement is reminding first, and then enforcement is required to get us from 75% to 80% or to 85%, then let's do that.
Dennis Ferrier at Fox 17.
Thank you. I appreciate you calling on me as always. The sales tax projection that Metro had for FY20, actually the city did better, but 67 million higher, which is of course good news. And of course that makes you wonder about 21, if sales tax could possibly be higher. I'm wondering, this is for Mayor Cooper, at one point do these kind of good news financial surprises go back to the taxpayers? And if we do better with the sales tax, if this continues, say, like the first quarter, is there any chance of maybe amending the property tax, since obviously the mayor knows how widely unpopular it is with residents right now? Thank you.
Mayor Cooper.
Well, nothing would please me or the council more than to share good news. But we can't pretend that there's good news. It is unclear. All the financial data for the end of the quarter don't really come in until the end of August. So it's a little bit unclear where we are, but it's also quite unclear whether our projections for the next fiscal year are going to be accurate as the path of the disease unfolds in real time before us. The absence of a second spike, the ability to get through this spike, projections on how quickly our hospitality industry and our hotel rooms can be booked, all are deep unknowns at this point. So what the leadership of the council helped provide is that we are prepared. We want to be over-prepared. We'd love to share good news with people, but it is so far away from knowing whether, in fact, that is good news, that it is premature to make any plan on this basis currently.
Harriet Wallace at Fox 17, you're on the air.
Yes, good morning. I've got just a couple of questions. The first one is for Mayor Cooper. Mayor Cooper, specifically the FOP, back to that issue, saying that they are really not in support of your order as the CEO of the city, of your order for them, or directive more so, for them to write these, citations to those who are in violation of the mask ordinance. What is your response to really them taking a position when the mayor of the city gave them a directive? If you could answer that specifically. My second question is for Dr. Jahangir. Someone reached out to me and said that he is disabled, does not have transportation, but needs to get a test what are the options for those who cannot get to the test sites? Thank you.
Thank you, Harriet. Mayor Cooper.
Thank you, Harriet. The great thing about our police force in Nashville is they are patriots. They serve and protect. And if they looked at today's press conference, they're going to understand the importance of saving lives and protecting our economy. There will be no health order issued in their lifetime that will probably be more important in the consequence of the outcomes for a successful city than this order. And their patriotism in this moment in encouraging, and their compliance is very important. And also they know how to do it. They're super professional. They're able to handle situations without escalating. They're able to educate. Never has their calling been more important, and never have we needed it more than right now, to serve and protect. This happens to be the way of doing that right now. No person in Nashville, including the police force, should remove themselves from the responsibility of getting this done for our city. Our businesses, our jobs, our children's future depend on that. And I can understand having one more thing to do in a population that probably does include disease deniers is a challenge. But not only are they up to it, they have shown time and time again how good they are at fulfilling their calling, which is to serve and protect.
Good morning. I'm pleased to let you know, in response to your second question, that there's a partnership with WeGo, and they are more than happy to accommodate anyone to transport them to any of the 3 assessment centers. All they need to do is call 615-862-5950. Then select option number 2 from the menu. And then once on the line with one of the customer service representatives, they just need to inform them that they're requesting transportation to one of the testing centers, and WeGo will take it from there. So thank you, WeGo, for helping us to get more people tested that need transportation.
Julie Palazzo at WKRN.
Good morning, everyone. Thank you for another update. Dr. Jahangir, 18% of hospital beds was the number you guys mentioned. So is there a certain percentage or requirement for the alternative care site at Nashville General to be activated? And I'm also still hearing from some folks that their test results have taken about 10 days, about a week to get back to them. And I know you guys switched labs, but just wondering what the reason for that still is. Is it because the new lab is still trying to catch up on some results that were sent to the old lab? And Dr. Caldwell, just want to get your reaction to the citations. I know that you guys are educating people about it the last couple of weeks, but the digital signs on Lower Broadway make it pretty clear to tourists that this is a requirement. So do you think that they were let off too easy? And are you all considering maybe putting more signs elsewhere, especially for visitors, like in the airport, perhaps? Thank you.
Thank you.
Thank you, Julie. There is a the issue of capacity is multifaceted. There is a hard number that the state has set as far as when they're considering alternative care sites. But I also think when it comes to capacity, you also have to think about staffing. Let's say that number was 2,000. There may be 2,000 beds available, but if we have now increased healthcare workers who get the disease or out for other reason, our capacity may be lower. So it is a kind of a fluid situation. I actually have a call this afternoon with the leadership of each of our health systems and with the state to kind of get a little bit more clarity around those trigger points. But we're not there yet. Your question regarding the lab results, I would have to learn a little bit more about specifically which labs the people you're speaking with received the test from. My understanding is the lab that the assessment sites were using previously, yes, there was a delay, but given the time frame, most of those results have been given to the individuals. The new lab, again, our experience has been 2 to 3 days is when the results line or the online portal that people can access directly to get the results, they can get it from. If it is from our community assessment sites that this delay is happening, and you can give me some more information, I'm happy to look in that further. And I think you probably know how they get a hold of me, and I'm glad to further follow up with you on that. And Dr. Caldwell for the next question.
Well, I really am very grateful for the partnership with the police. Every time that we can demonstrate more leadership, provide more impact, have more consistency, continue to reinforce the message, it is very helpful. We are trying to shift some of the culture of our community to understanding that these face masks are critical to us being able to move forward, to get this virus to be suppressed, and then to reopen our community. The police gave over 170 verbal warnings in the first day of enforcement, and I really think that is a great start. It's only a start. We have much more to do. And you're right that it's important that we greet visitors as they arrive into Nashville, and we are looking at having additional signage as well as citation zones. And remember, these are more compliance zones. We're not really looking to cite people. We want to assure compliance. Citations are that final piece to assure compliance if necessary. But the goal is compliance. We already greet people at the airports with information and signage. And we also provide everyone arriving with written information about what the rules are in Nashville. So if you're arriving by the airport, you already know what the rules are. We know a lot of people travel to Nashville in a lot of different ways, and we'll be exploring additional ways that we can educate people about what's expected here when they visit Nashville.
Julia, I have an updated number here from the MNPD. 494 verbal warnings were issued, as well as 79 masks given to homeless individuals yesterday. Our final question is from Nate Rao at the Tennessee Lookout. Nate.
Hey, my question is for Mayor Cooper. If it's clear that Nashville residents are catching the virus from traveling outside the county, have you advocated Governor Lee to issue a statewide mask mandate, and what feedback are you getting from him about that?
Thank you, Nate. Mayor Cooper.
Yes, Nate. I was in a previous press event. I do feel, as anybody in my position would, that counties that have a high case risk, which are currently, where you are currently prohibited from going to your nursing home and visiting your loved ones. If the case count is high enough there, I personally feel you should also have a mask ordinance, right? That's a simple metric that the state can apply. The state is already applying a restriction in those cases because of the outbreak. It's a very logical thing to do. I would encourage the state to make that happen. It would seem extremely reasonable. It would also cover, frankly, our economic region in Nashville, where people travel in and out. We need to be as effective as we can be here, but we are also not an island. And with the more coordinated a response that there is among states across the nation and within a state, undoubtedly, the stronger there will be. There are clearly going to be counties in Tennessee where the outbreak is not that bad, though in many rural areas it can spread like wildfire too. But if there is already a state response in a county restricting nursing homes and our most vulnerable, then recognize that that same disease outbreak there is also worthy of another consideration, and that would be a mask. And I hope the country evolves behind an every state for itself and every county for itself approach to this. Ultimately, that's how we're going to be effective. And this, we have to be ready for the long haul here. What do we know, again, is this is not over because we want it to be over. This is going to be a long, sustained, disciplined approach that's going to require all of our efforts to get us back to normal. Thank you.
That's all the time we have for questions this morning. We're very grateful to B.B. Winans for joining us, and we all wish him continued health. And thank you to Amanda Brock from the Mental Health Cooperative for joining us today. The next scheduled Metro COVID-19 press briefing will air on Tuesday, July 21st at 9:30 a.m. Thank you for joining us. This concludes today's event.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.